All right, we're back. I think this is our sixth video for the
Yeah.
Direct Primary Care show in Central Virginia with Dr. Anderson on the split screen with me, Dr. Farrago. We're both doing direct primary care. If you want to know more about that, we'll post some information at the end of the video. You can go look at our sites, but it's a monthly membership. We don't deal with insurance. So let's go to where we're at now. We are early May. May the 4th be with you, and then Cinco de Mayo. We're split between them too. Some heavy holidays here, and we're still stuck inside. Dr. Anderson, you're seeing patients now a little bit. You're more open than you were, because I know we are.
Yeah, so we've been doing a lot of video and phone appointments. We've opened it up a little bit more. We're taking a lot of precautions, and patients understand. I mean, we have folks that have cancer and who are elderly and high-risk populations, and so it's working really well. If people can do it from home, then we do one of those fancy video appointments. And
Right.
If not, then they come in, and we're taking the precautions just because we need to get back to some of these issues that are going on that you just can't do over a phone.
Now, I'm going to scratch my nose because I have to. And yes, that is my nose. I'm not eating a banana. I've got, it's just the camera's not flattering to my big nose. It is what it is. And I will wash my hands. I have hand sanitizer right here in my office, which I use 1,000,000 times a day. We're doing the same in our practice. So here's the deal. And if our patients are listening, wear your own mask coming in. You can't come in without a mask. And I have a box of some surgical masks. Only a few are left. I can't get them. I still can't get them. And so the bottom line is patients need to wear a mask. Then I wear a mask, and then we glove up, and I have goggles on. And why do we do that? I put out my newsletter. If someone has coronavirus and you have a mask and they don't, that doesn't work so well. But if they have coronavirus and have a mask and you don't, it's better protection. Now, if you both have masks, then it's like 1% transition there, which is pretty good, right? And there's ways to jimmy rig those masks with pantyhose and rubber bands. You can look them up on the internet now to make even surgical masks or something even tighter. But the bottom line is, if you have a mask with coronavirus and I have a mask, then it's like a 1% possibility. But that's if someone has CV-19. So if we're going to loosen things up, which we both predict is going to happen, and I think the governor yesterday was kind of saying now that we're going to start loosening things up. Yeah. We're going to have to loosen up like with a mask. What say you, Dr. Anderson, about that?
So these decisions have a big impact downstream. And so we are going to have to open up to one degree or another to a little bit of normalcy. There has been a lot of concern, and it's already being seen in parts of Asia. A second wave is what they're calling it, where they're getting hit with round 2, effectively, of COVID-19 infections. And theoretically, the same thing's going to happen here. And as we open up. And so as we open up, we need to do something that prevents that. I think masks are one of the best things that we have, even though it's not amazing, it's not perfect, but it's easy, it's cheap, it's accessible to everybody, and so we can do that. The other thing that I think is interesting that hasn't been released yet, they've done a version of it in China, is the physical tracing. Google and Apple are working together and working on something that kind of looks back at where you've been for the past 2 weeks. If somebody that you've been in contact with shows up positive for the virus, and they've made all kinds of claims and publications that it's not going to track us and things like that. It's not going to send information to the government or anything, but things like that I think are interesting. That helped a lot in China, and then masks as well. And so I personally am feeling the need to open things up a little bit. We've had to with our patients just because we've had people that are sick that need help, and we weren't able to do that. And so we need to make some concessions.
Let me ask you a question that will help patients and myself. I'm at the office today. I saw a few patients already. I don't wear scrubs. I wear regular clothes. If someone, I mask, they mask. But let's just say the virus got on my clothes. What's the story? Or other stuff? What do we got here? How long is it going to
So
last on things?
yeah, so there was a study a few weeks ago, the New England Journal of Medicine, and they looked at a lot of different materials and how long the virus was viable on each material. So the one that hit the news pretty quick was 3 hours aerosolized, that it's living in the air for up to 3 hours. On copper surfaces, 4 hours. On cardboard, 24 hours. On plastic, glass, and metal, 2 to 3 days, depending on a few variables. But you mentioned your clothing. Something that wasn't on that list is clothing, and so there was a really well done article by the New York Times, wherein they interviewed a pediatric infectious disease and aerosolized virologist specialist. Didn't know one of those was a thing, and they say that clothes most closely resemble cardboard in that, because it draws the moisture out of the virus, and the virus needs a little bit of moisture to survive. And because it dries it out, it shortens it, versus something like glass or plastic, where it stays just as wet as it needs to for longer.
Now that has to be inside because outside the sun and the heat will kill it quicker. Correct?
Yeah, so there's
Yeah.
a lot of variables. Yeah, the
Yeah.
drier it is,
Yeah.
therefore the warmer it is. Usually that helps as far as how long it lives on surfaces. That doesn't equate to it's going to be summer, we're not going to have viral infections anymore, because there's a lot of countries that are being affected full throttle that have been in their summer for a long time.
Yeah. All right. So testing, we can do some testing here. Most people are going to the health department or center urgent care. We've been offered through um, LabCorp to do an IgA, which we really can't do. They say that's for hospital. IgM and IgG, which is going to be, I think, about $60 for the M and $60 for the G, to see if you're actually immune. You've had it and you're done. And there's issues with whether you can trust these antibody tests, right? So if it's a COVID-like coronavirus, which coronavirus is, some colds are coronaviruses, could that cross over and say you were immune to that, thinking you had CV-19? What's your thoughts on that?
So it comes down to two things, and I've had a few patients rightly ask, "Hey doc, can we do these antibody tests?" And it comes down to these two things. One, you already mentioned it a little bit, that it will test positive for COVID-19 like viruses. So you can
Right.
test positive for antibodies that say, "Hey, you've had COVID-19, you're good to go," when actually you haven't at all come across it. And then you run the risk of now coming across it because you feel bulletproof. The second thing is, and this contradicts a little bit what I said earlier, but is that antibodies don't equate immunity. We talked in, I think, our first video about the microbiology of this virus, and how, because it is so foreign, because it's an animal virus, that we don't form immunity the same way we do to other human viruses like the flu. And so the WHO is starting to release stuff on this, saying that if you have antibodies, that doesn't necessarily mean you're immune to it. It's interesting. It's not cut and dry. You do seem to be a little bit immune to it for the first little while. That can be days or weeks for people where you just can't be reinfected, but then that seems to wear off, for lack of a better term, and so that you can, it looks like, be reinfected to a degree. And so for those two reasons, these antibody testing kits that are coming out aren't as useful as we maybe first thought.
So that's a
Unfortunately.
controversial topic. One is the testing. Two is the reinfection situation. And I'm not in that. For many reasons, the WHO has been suspect in a lot of things they've done, right? And so I'm not really loving them right now. I never did anyway. But I My gut feeling is I'm not buying that, and I could be wrong, but I'm hoping I'm right, because the bottom line is people need to be immune to this stupid thing, right?
Oh, yeah. I mean, herd immunity, please. I
Yeah, yeah,
mean, I uh, I want us to all just be done with this.
yeah. We all want to be
Yeah.
done. So the bottom line was to flatten the curve so that we don't overuse our hospital resources and people are dying in the hallways. We've done that here in this community. I think we've had 2 deaths, and I think we've had 20 in the ICU, and the total of cases are, I don't know, maybe 30s, 40s. But again, the testing was
Yeah.
pathetic here. They were using criteria that was, at least for a long time, that was,
Too restrictive.
have you eaten a bat in Wuhan recently? Kind of. Well, no, you don't get tested. That's an
Yeah.
exaggeration. But I mean, they really were pretty ridiculous on some of these. And so I think it was higher. I think I've had a few patients that probably had it. It doesn't matter.
I do too.
I think it's still one infect. I believe it'll be around 1% infection rate, a fatality rate. Excuse me. And when it's all said and done, I think if you're sicker, it's worse. I think there's some genetic predisposition we don't know about, or something else that makes it worse, because some people weirdly really do very poorly and some don't. It definitely has that weird thing we talked about where it affects the blood, and so it's not just a pure pneumonia. It definitely affects oxygen saturation rate, which is weird. I have to think, though, I don't know if the viruses that people never get immune to. So this reinfection rate, I want to see more information about that. I think we do, like you said, herd immunity. We need enough people who are immune so it doesn't bounce around and it's gone.
Yeah, and everybody's got their eyes on. Is it Sweden?
We did not lock down.
Yeah, who didn't lock down, but they urged everybody who is at high risk to take care of themselves at home and kind of isolate themselves if you're at high risk. And at first, it looks like, holy cow, this is the way to go, because everybody wants that. Let's keep doing what we're doing and not have a fallout. But when you correct for per capita, it seems like their numbers are worse than the
Yeah.
U.S.
Yeah.
Which is a bummer,
So,
because we were like, let's do that. That
yeah.
looks so much more inviting than what we're doing here. But
We
it's
predicted,
validated what we've done for the past month and a half.
in our talks, we predicted that patients and people were not going to hold out. It's going to be only so long. The same people who are ready to go in their bunker for a nuclear war for 3 years can't last them more than a month. It's not nothing personal. I get it. It's really hard. It's not easy being held hostage in your house. And so the bottom line is, as you can see in Michigan, you can see now in other states that are fighting back, states that are opening up. It's going to have to open up soon. We have to do it with masks. People need to stop being stupid. I still see certain people who refuse to wear masks. It just blows my mind. If you're going to go into a public place for right now, you're going to have to wear a mask. Now, I think the governor was talking about soon, the limited capacity for even from restaurants, like they're doing in Texas. I think they have 25% and so forth.
Yeah, Georgia's doing that,
Yeah.
where they're up a little bit. Although their risk of getting, my brother lives in Georgia. We were talking about this last night. They calculated the risk of getting COVID-19 went up by like 40%. I don't know how they did the math on that.
Yeah.
But since they started reopening, and I don't know, I'm so over this virus, though.
Well, I think we all are. So I'm going to end a couple ways, or just one way we'll start with. So there was a video on YouTube that was taken down. 2 doctors owned an urgent care, and they went on to say, did you see that video? They said the mortality rate was 0.03%. Now, the problem is, even I'm not a statistician, and that's not my specialty. However, the numbers they were taking, they used the wrong denominators on purpose. And then they compared it to New York, and the denominator, they said, here's how many were infected. And the denominator, they used the whole population of New York. They changed the whole denominator again, and they said, look, it's only 0.03%. When in reality, they did everything you can do wrong. And these are 2 doctors, and I got to defend myself, unfortunately, to some people who were, and think this is a hoax, said, look, these guys said it's only 0.03%. It is not. It is a high infection rate with a decent mortality rate. We don't lose 60,000 to the flu in a month in this country. That doesn't really happen. And that's with social distancing. So the bottom line is, even you got to be careful who you're listening to. And I hope and I don't think you have said anything controversial here. We try not to, because we're not trying to make our name out there. We're just trying to give some information that we think, and that we are is valid. So try to listen to doctors who have no financial gain, which these guys questionably did because they own some urgent cares.
Yeah, they
And
have.
and we have to be careful about that. The stuff I'm seeing on the internet sometimes is a scam. So just be very careful. That's my only guideline for patients: is be careful who you listen to. Your
Well,
thoughts?
agreed.
Yeah.
Yeah, I was even asked by a patient about that specific video today.
Yeah.
And yeah, we talked about the secondary gain that they had from their video and their message, and then how the numbers were skewed.
Yeah. So we are at a point where we're over the hump. Doesn't mean, but just because you're over the hump does not mean you're that far past hump that things are better. We're going to go slowly and open things up slowly in our offices, in your office, and hopefully in our local area, it'll slowly open up. And we still want to stay safe, so everybody should still wear their mask. I guess that's our point today. Be careful you listen to, wear your mask. And if you need information about us, you'll see it at the end of this video. How do you want to end it? Any thoughts you want to end with, my friend?
Let's see. How do I want to end this? Every once in a while, I'll pray with my patients. And I had a patient today that she asked the Lord for people to use common sense, and and I liked that a lot. I'm having to learn what common sense is. Wearing a mask. If you asked me 3 months ago, is that common sense? No, but it is now. And so that's my parting phrase. There is. Yeah. May we have common sense.
Yeah, I saw a picture of a person with a mask who cut a hole here because she couldn't breathe that well out of it. That's not common sense. So you still want to wear a mask and cover your nose and your mouth. Wash your hands regularly. Wash your clothes regularly. And you and I will come back hopefully in a week. We'll talk some more. All right?
All right. Good talking to you.
Good talking to you. See you later.
Take care.